A group of Quebec doctors recently warned of the dangers of poor air quality. The Quebec chapter of the Canadian Association of Physicians for the Environment says smog can affect every organ in our body. Dr. Suzanne Levitz is the medical director of the Inpatient Pulmonary Rehabilitation Program at Mount Sinai. Thank you so much for joining us today.
Thank you for having me.
So we've had smoke alerts caused by wildfires. We also get smog alerts all year round. But what exactly is smog, and does it really matter whether it comes from wildfires or factories or cars?
Well, smog is severe atmospheric pollution suspended in humid air. It's a result of human activity and natural events. So where the smog comes from does matter. Different activities release different pollutants, and so it varies with what's being burned and the time of year. For example, burning fuel will produce volatile organic compounds and various gases like nitrous oxide, sulfur dioxide, whereas wildfires produce more particulate matter, like small little particles that go in the air. In the summer, all of these particles are suspended in the humid air, and because the air is also stagnant, it stays on the ground for several days. High temperatures in the summer promote chemical reactions that produce harmful substances, especially ozone. Ozone is the prime culprit. And I just want to clarify here, we talk about ozone and the ozone layer, which is good for us. The ozone layer is way up in the stratosphere, way above where we're breathing, and it does protect us from harmful UVB radiation. But the ozone that I'm talking about is here around us in the troposphere, what we breathe in every day, and that ozone can be very harmful to our health.
So we are breathing in these particles. It's said that they can affect every organ in the body, even lead to premature dementia. Why do these particles have such broad effects on us?
So there are many different particles, and they all come into our bodies through our lungs. That's the way they get in. The big particles will lodge in our upper airways, and they'll produce a cough or an irritation, and we'll clear them out. But those small little particles will work their way down our lungs into our smallest airways called the alveoli, where they can be absorbed into the bloodstream. Once in the bloodstream, they can go anywhere in our body. And depending on what chemical has come in with the particles, it can affect different organs in different ways and go anywhere from the liver to the brain.
Now, one of the things that you told me earlier when I was talking to you is as much as we worry about the air quality now, you say it's actually better now than it used to be decades ago.
Absolutely. Like several decades ago, there were several big smog events, like the fog in London and events in LA. And now there's been a lot of improvement because of a lot of initiatives that have occurred, such as the World Health Organization and government bodies who have created standards for emissions. We've also moved away from dirty fuels like coal and have worked on our fuels to make them cleaner burning and less toxin producing. Our motors and engines have also evolved, and with attrition, we're getting better and better, more efficient engines around. What has happened, though, is that there has been an increase in natural events like wildfires, and that's really brought this more into the forefront.
But you know, decades ago, we didn't worry about wearing masks or we weren't told to stay indoors. So why is it necessary now?
Well, I think over the years we've studied pollution and been able to break it down into all its components and study each of those components to see what they do to us. And so we've been able to advocate and target those pollutants, I'll call them, and aim towards them. And people have become more aware. They're very in tune with their own bodies and with what's going around them. And media, including social media, has made us one big world community. So we can follow and monitor and track and advocate for things everywhere in the world.
Now, is this just for older people or people with chronic conditions, or are younger, healthy people affected as well? Should we all be taking precautions, and to what degree?
Well, yes, basically the answer is yes. We should all be taking precautions, but certainly older people, people with chronic medical conditions are more at risk, especially people with lung and heart disease. And the other population we have to be really concerned about are children and pets who have small little lungs, breathe faster, and spend more time outside. So they're almost by definition more exposed. but even healthy young adults who have no underlying conditions can be affected by the smog and pollution. Should we take precautions? Yes, absolutely. All of us should. On a bad air quality day, and you would know this by checking your phone app or checking online different air quality indexes to see what the air is like. And if the air is bad, you can consider either staying inside with your windows closed and your air conditioning on. And if you don't have air conditioning, maybe going to somewhere like a mall or a community center where the air quality might be better than sitting in a stuffy house or apartment. And if you do want to go outside and exercise, and it is important to get out there, maybe exercise with lower intensity or for a shorter period of time. The
Okay.
other thing to think about is not exercising like next to a highway or a factory where the intensity of the pollution will be higher. You can wear a mask, but if you're going to wear a mask, it's something like an N95 mask that can really keep out those small particles from getting into your lungs.
Okay. Okay.
Inside your home, you should also be cautious about burning wood fires, wood stoves, because that just adds to the pollution. And if you have asthma or COPD or chronic lung condition, you should always keep your rescue meds near you because you may react much more quickly than someone who doesn't have those conditions.
Okay. All very, very useful information. And thank you so much for taking time to talk to us today, Dr. Levitz.
Thank you so much, Mitsumi.